You need to do that. Number 2, scheduling a COVID test. Number 3, packing up all the material that you will need for your final exams. For more information on how to prepare for the winter break, visit tiny.utk.edu/make-a-plan. That'll help. So now let's go over today's data. As of yesterday, we have 97 active positive cases. 90 of them are students and 7 are employees. This total includes 11 new recoveries. You can see there that the numbers are going up. Dr. Gregg is going to talk some more about that. But we are now at 97 active cases, 90 of them students. Also, let's talk about quarantine and self-isolation. So just as when the numbers go up, the number of cases, the number of new cases, the number of people in isolation go up. So you see the same pattern happening. As of today, or as really last night, we have 460 people in quarantine or self-isolation. Of those, 395 are students. And if you look at that graph, what you see is a pattern, sort of like we started at the beginning of the semester. Slightly more of them are non-residential students than residential, but the number is going up of people in isolation. Now let's think about our community testing. Last week, we collected 946 samples from residents in Magnolia and Dogwood Halls, in all of Sorority Village, and in makeup tests. So if you look at those numbers, the samples were divided into 299 pools. Remember how we do that. Each pool consists of 3 to 4 students. So out of those 299 pools, we found 8 positive pools. That meant that 26 people represented in those 8 pools were sent for further diagnostic testing, which resulted in 6 individual positive tests. So that's how you read those numbers. We had almost 76% of everyone who was supposed to participate participated. So again, we've been shooting for the 75, 76, 80%. We're happy about that. And you can see that is the picture of the asymptomatic positive cases on campus, in the dorms and in the residence halls. So I've got some questions, Dr. Gregg, for you. Let's start with, let me just say one other thing. We also had a cluster identified in the last week, and that resulted from an off-campus get-together, I think it was around Halloween, with students. So that's the last piece of data. So let's start with Dr. Gregg, and maybe let's just go right into, what about that cluster? What can you tell us about that?
Chancellor, happy Friday the 13th.
Yeah, oh, great.
It's great to be with you again this morning. We did have a new small cluster identified this past week. It stemmed from a get-together among students on Halloween. There were 5 positive cases, 4 close contacts identified. And because of the cooperation of those students, we were able to quickly perform contact tracing. The importance of their cooperation can't be understated. The willingness of those students to do the right thing was critical in allowing us to get ahead of this incident and limit its spread. So we really appreciate that from those students.
That's great. Cooperation is the name of the game. We really, it's invaluable for keeping the campus safe. So I applaud the students for doing that. Let me just ask you, let's keep going here, because it seems a bit of a disconnect at times. Our numbers on campus have remained relatively low, while the broader community continues to see a rise in cases. So what does that mean for us, and what can we try to do to prevent the spread among our campus community?
Well, although the number of new cases had remained relatively low and stable over the past month and a half on our campus, the greater Knoxville community and even the state have definitely witnessed a concerning rise. Just over the past several days, though, we too have had a slight upward trend in the number of active cases, especially amongst students and those needing to quarantine because of being in close contact. That's not a trend we want to see continue. Having to start isolation or quarantine right now, that's absolutely going to ruin your Thanksgiving plans.
Yeah.
As students, faculty, and staff finish out this semester on campus and prepare for the break and holidays, it remains imperative for everybody to stay mindful of appropriate health and safety guidance to prevent exposure and spread. If you're sick, please stay home. A lot of the spread across the broader community is happening in workplaces. Fortunately, it's not been as great a problem in educational settings, likely due to stricter precautions, but we're still at risk. We don't want to see that reversed. Staying at home when you're ill is one of the most important measures that students, faculty, and staff can take to protect others. Practice physical distancing. Stay at least 6 feet away from others whenever possible. And if you must be within 6 feet, limit that duration and frequency as much as possible. Don't forget to wash your hands or use hand sanitizer regularly. Avoid touching your face, and remember to clean frequently touched surfaces before their use. Finally, and this appears to be key, wear your mask, not just here on campus, but everywhere. We're seeing more evidence that masks protect the wearer as well as those with whom they come in contact. In fact, the CDC just published new information in this regard on Tuesday. Just yet another reason to be sure you're wearing your mask.
Okay, so one last question that's coming to mind is, as students begin making their plans for departing campus, we told them to make a plan. They're going to spend winter break at home. What should they be doing? And how do they get the flu shot? How do they get a COVID test? Could you go through that one more time?
Well, they definitely need to start their preparations now. If you've not yet received a flu vaccine, get it before you leave for home. The Student Health Center pharmacy has the vaccine available, and an appointment is not required to get it. You can drop by and get one, students and employees. It only takes a few minutes of your time. Make sure you get a COVID test a few days before you leave. They too are available at the Student Health Center, both for students and employees. But make sure that you plan for that test. It'll take anywhere from 1 to 3 days to get a result back, depending on the test that's performed. And you'll need to complete your online self-isolation form and self-isolate while you're awaiting the results. Once you've received the results, if positive, our contact tracers will assist you in regard to your next steps. If you're negative, then continue to separate yourself from others as much as possible. That way you reduce the likelihood of an exposure before you leave. And finally, continue to practice appropriate health and safety measures prior to and during your return home, as well as upon your arrival there. You want your break to be safe for you and for those you'll be with. With what's being seen around the state and the country, now is not the time to let your guard down. Remain vigilant. On our COVID website, we've posted links to some additional great information or reminders from the CDC regarding celebrating the holidays safely. You can also find that information on the CDC website by typing Thanksgiving into the CDC site search box. It lists things that you might not have thought about to stay safe for gatherings, like having a small outdoor meal with family and friends, or if having to celebrate indoors, make sure to open the windows, limiting the number of guests that you have, and have conversations with the guests ahead of time to set expectations for the get-together, limiting the number of people in the food preparation areas, or just have your guests bring their own food and drink and use disposable supplies such as paper plates and plastic utensils. It also lists important safety tips for travel during this time. I really encourage everyone to take a look at that information.
You know, I'm glad you mentioned that, because just this morning I went on that Thanksgiving website on the CDC guidelines. Every parent on this call, everyone, you should go look at it, because it was really helpful to me as I think about what I'm doing on Thanksgiving and what I hope to do around the longer holiday season. Really, really good, easy to read, quick suggestions. It's going to be different, but if we take care and if we practice safety measures, we can get through this with less disruption and less danger to everybody. So thank you, Dr. Gregg, for all of that and for everything that you've done since last spring, all summer. I don't know where we'd be without you. So thank you so much, Dr. Gregg, to you and your entire team. So with just a couple of weeks left in the semester, I want our students to finish the academic term just really strong. It's been hard. I know it has. I'm so proud of all of our students. They've adapted to something they didn't want to adapt to and have just been graceful as they've done it. I'm really, really impressed. I know it's been an unusual educational experience in a lot of ways, but it's important to dig in and stay focused. So, Dr. Zomchik, our Chief Academic Officer, what tips do you have for students as they head into the last couple of weeks and then final exams?
Thank you, Chancellor. Yeah, I have a couple of tips that I'll be happy to share on this beautiful fall morning. First, I want to remind them of what you said, that as they pack for a trip home or to wherever they're going, make sure that you take with you everything that you'll need or you even think you'll need for your final exams. You know, and as you head into this last week also of classes, you know, it's a good idea. If you're in study groups, make sure you've got a way to contact the people that you've been studying with over the course of the semester. Maybe set some dates to study for the final exam together. It's certainly, I think I've always found it more helpful to work with others than to work on my own. So think about doing something like that. Prepare for that final, for all of your finals. Familiarize yourself with the test, what's expected on the test, what the rules are for taking the test. And even if it's an open book exam, make sure you know the material so that you don't have to waste precious time during the exam paging through your notes or looking for the material that will help you answer the question. And finally, and really importantly for in preparation, check your technology. If you need to update your computer, do that well ahead of the time that the test is scheduled. Make sure that everything is working correctly. So another tip here is make sure that the space that you're going to take the exam in allows you to focus. If you're at home or if you're in your apartment off campus, let your family or roommates know when your exams are scheduled so that they don't barge in, so that they don't interrupt you or disrupt your concentration. Find a quiet place to take your exam, turn your phone off, and just leave yourself enough time before the exam to kind of decompress, to get ready to focus on the task ahead of you. Once the exam is over, if you have an opportunity, go back and think about the questions that you've answered. Take some time to review because a lot of learning goes on after the exam as well. Equally important to decompress, take that next exam, go outside, go for a walk, take a deep breath, or as Pat Summitt used to say, right foot, left foot, breathe. We know that you can do it. As the Chancellor said, we all believe that you're going to finish this really unusual and challenging semester in the same strong and resilient way that you've gone through the semester. So these tips that I've mentioned, you can find them on our Student Success website under Vol Success Tips. Here's the URL, studentsuccess.utk.edu/finals-online. So good luck in your final exams. Go Volunteers. We know you got it in you. You're going to do it.
These are really, really good suggestions. And thank you so much, Provost Zomchik. Next week will be the last live update of this semester. Now, I've got a big meeting with our campus advisory board, so I won't be able to be here, but Dr. Zomchik and Dr. Gregg will be. They will be your hosts, so make sure you tune in. Thanks, and everyone, let's stay safe, practice smart behavior and precautions, and we'll get through this. Thank you, everyone, and go Vols.